Hello, and welcome back to Nurses Notes 101. This is Alexa. Today we'll be talking about cardiac tamponade. The picture on the left is a depiction of a healthy heart versus a heart that is tamponading, I'm going to say. So you can see the extra fluid in the pericardial sac, and that's what we're going to be talking about today. So, cardiac tamponade is actually a medical emergency. So, this occurs when fluid accumulates in the pericardial sac, which is the sac surrounding the heart, and it compresses the heart, which in return can cause decreased cardiac output and cardiogenic shock. Cardiac tamponade is diagnosed via EKG. An echocardiogram is the gold standard, and it can also be diagnosed via X ray and CAT scan. So the patient's presenting, let's say, with a history of hypertension, high cholesterol, CAD. They sleep with 3 pillows when they go to bed. They have issues walking around. They live a pretty sedentary life. So this is all things you'll have to be thinking of when you see a patient presenting in a very cardiac way, in a very cardiac dependent way. The EKG is performed on this patient and it shows electrical alternance. So, electrical alternance is a condition in which the QRS amplitude in each beat of the heart is alternating. And this is due to the heart moving in a space with excess fluid. A lot of times, the EKG will also show sinus tachycardia. Like I said before, the gold standard for diagnosis of cardiac tamponade is an echocardiogram. So an echo not only can confirm that there is pericardial effusion, but it can illustrate the heart's functionality and how much the heart is affected by this excess fluid in the pericardial sac. A CAT scan and a chest X-ray has the ability to show an enlarged heart and pericardial effusion as well. In the picture to the left, you'll be able to see the electrical alternans depicting a larger and more amplified QRS complex for every other beat. And then we're going to go over Beck's triad in the next slide. So the signs and symptoms of cardiac tamponade, there are 3 that we look out for. So this is considered Beck's triad. This includes bulging neck veins or jugular vein distension, depicted on the left side in picture 1. Hypotension, which is due to the fluid compression on the heart, which causes the low cardiac output, and then muffled heart sounds. The muffled heart sounds is also due to the excess fluid. Other signs and symptoms that you could see in a patient with cardiac tamponade is pale skin, palpitations, sharp chest pain, and anxiety. Treatments of cardiac tamponade, the usual one that we see is a pericardial centesis or pericardial window. So this is when a needle is inserted right directly into the pericardial sac to drain the fluid out. So if for some reason this treatment doesn't work, they can't perform the needle aspiration, they will perform open surgery. So this is performed via thoracotomy, so they break the sternum open. It can be performed bedside as well, but definitely more of a risk there of infection with a more surgical intervention. Major risks of these treatments include bleeding, a pneumothorax due to the needle aspiration if it was placed in the wrong position, or a heart attack. Okay, that concludes our discussion on cardiac tamponade. Thank you for listening to my channel. Please like and subscribe.